So welcome again, everybody. We appreciate you taking time out of your schedules to join us to learn more about navigating healthcare on behalf of your kiddos. So before we go ahead and dig into the meat and potatoes of tonight's workshop, I want to go ahead and just briefly introduce myself because I'm seeing I know there's many new faces on tonight's call, even though you can only see me. I know there's many new folks joining Pacer for the first time. So my name is Bahia Manasra, and I work with our Health Information Center, specifically working with parents and professionals to educate them on resources that are available to them so they can in turn serve as their children's best advocate. Given we do have quite a few people on the call tonight, with the expectation more will join, even though we don't have enough time for everybody to introduce themselves, given this is also a webinar format, I'd still like to give you an opportunity to let us know who you are. So the chat feature is enabled. If you just want to indicate if you're a parent or a professional and include your name. So with that being said, let's go on to the next slide to talk about our agenda. Next slide, please. Wonderful. So tonight we'll be talking about the key differences between public and private health insurance. So this is very much meant to be an overview training or an overview workshop, excuse me, on just how public and private health insurance works in the state of Minnesota. So we're also going to explore tips for advocating for children who have significant healthcare needs, and then just go through some resources to best help you navigate some of the complexities around health insurance, both public and private. Next slide. So we're going to take a big step back and just plainly talk about how health insurance works. Oh, sorry. Next slide, Jamie. There we go. So we're going to go ahead and take a big step back and plainly talk about how health insurance works and just the different options available to you and your family. Next slide. So we're going to start with private health insurance. So Minnesotans can access private health insurance a few different ways. The majority of working adults, like you and Mia, will typically opt into an employer-sponsored plan, which is provided by employers as part of employees' compensation and benefits. Costs are often shared between the employer and the employee. So this can include premiums, it can include copays. This insurance option will typically offer more comprehensive coverage compared to individual plans on the marketplace. Speaking of which, so we also have the marketplace in Minnesota, also known as MNsure. And so MNsure is a publicly accessible platform that lets people compare and purchase health insurance directly through the marketplace. This platform does include qualified health plans that do meet ACA requirements. So ACA stands for the Affordable Care Act, which was passed about a decade ago, a little over a decade ago, with the specific caveat that private insurers on the marketplace can't reject people with pre-existing conditions. So that's what it's mostly known for. There are also tax credits and subsidies available for eligible to low to moderate income people that can also opt in to marketplace options too. Across all the plan types, there are key features in common. So to start, we have premiums. These are the monthly costs to maintain coverage that we typically pay out of our paycheck. And they vary by plan and by coverage level. There are also deductibles, which are out-of-pocket expenses you pay before your insurance will start to cover most of the services. And then we also have copays. So these are the fixed fees for specific services like doctor's visits and prescriptions we have to pay right when we're getting that service. So each plan also has certain networks in which they operate within. Coverage is going to be dependent on in-network providers and services. So marketplace plans and employer-sponsored plans, they're going to have different plan tiers, typically with different levels like a bronze, silver, gold type of level, with each one varying on cost and coverage levels. Next slide. So now let's talk about public health insurance options. So we have medical assistance, also known as MA. This is Minnesota's Medicaid program, which basically covers comprehensive or offers comprehensive healthcare coverage for children, for adults, and people with disabilities. So when it comes to eligibility for MA, that's going to be based on a person's income, their assets, and specified criteria like their disability status. There aren't any premiums, and there may even be some small copays for certain services, which are very, very minimal. There's also the TEFRA option with medical assistance. So TEFRA it stands for Tax Equity and Fiscal Responsibility Act. It's basically a Medicaid option for children with disabilities who need a level of care that's similar to what someone would get in a hospital or a nursing home. So the TEFRA option lets families with higher incomes qualify because it's solely based on the child's income, which is usually non-existent. Typically, we get calls from parents who have children under the age of 18 that are trying to access TEFRA, and usually those children aren't working. So it reflects in the application as they receive no income, which allows them to be eligible. So the TEFRA coverage provides quite a few services, like different types of therapies, specialized equipment, and even personal care support that might not be covered under private insurance. We also have Minnesota Care. So this is a health insurance program for Minnesotans who have lower incomes but don't qualify for medical assistance. So Minnesota Care covers basic health services that includes doctor visits, hospital stays, prescription medication, and other services too. It does require people to pay premiums and copays, which are going to be adjusted based on that person's income. So sometimes they'll pay as little as just a few bucks. Coverage, income limits, and eligibility for these plans are going to also differ a bit. So for medical assistance, income limits depend on someone's age, their family size, and their disability status. So, for example, children under 21 and pregnant women typically qualify with higher income limits because they have extenuating circumstances that make them eligible. For TEFRA, eligibility is going to be based on the child's medical needs. For Minnesota Care, a person's household income needs to fall within a certain range based on the federal poverty level. And I think it's between like 140 to 200% of the federal poverty level. Next slide, please. So now let's go ahead and compare both private insurance and public health insurance. Next slide. So there are different eligibility and enrollment guidelines for both types of health insurance. So to start, for programs like medical assistance, TEFRA, and Minnesota Care, these programs are going to be income dependent and have limits which are going to be influenced by federal poverty level guidelines that I was just talking about. So factors that also influence eligibility are going to include age, family size, and disability status. To enroll, it's going to be year round for medical assistance and TEFRA. So folks can opt in anytime. And then under Minnesota Care, annual re-enrollment is going to be required for everyone that's currently on the coverage during open enrollment season. So to apply for a plan on the marketplace, it would be through Mincher Online, or via your local county social service office. Basically, when you're applying, you'll provide income verification, disability documentation if that's applicable to you or your child, and household information. For private health insurance, it's going to be available to people and families regardless of their income, but premiums and costs are going to vary. There aren't any disability specific qualifications for private health insurance, and then coverage is going to be based on the purchase plans. There are annual open enrollment periods, which typically run from November to January of each year. So right now would be considered open enrollment season for those plans. There are also special enrollment periods for major life changes. So if you lose a job, if you're getting married, if you're having a child, or if you're adopting a child, those would be considered eligible major life changes that would allow you to enroll in insurance at that time. Next slide. So type of coverage is also going to differ between public and private insurance. So services typically covered for medical assistance, TEFRA and Minnesota Care typically include personal care assistance, waiver programs which cover additional services for people with disabilities. So that can include housing modifications, in-home support, and respite care. There's also other coverages that may include speech therapy, occupational therapy, and physical therapy. usually providing access to specialized providers. A lot of children that we know of that are utilizing the tougher option utilize therapy services pretty heavily. So that's the nice thing that's a nice perk that comes along with that public option. Under these plans, healthcare is going to be comprehensive because they cover doctor's visits, hospital stays, emergency care, mental health services, dental care, prescription medication, and there's a lot more. And so that's the nice thing about public health insurance is there's quite a bit of coverage with fairly little cost associated with it, if at all. Um, so when it comes to private health insurance, they generally cover standard medical services. So these are your doctor's visits, your prescription medication, any hospital stays, and some mental health care. There may be coverage gaps, including like limited or no coverage for PCA services. So that's the personal care assistant services. There's usually no coverage for waiver related benefits or long term therapies. Those are usually out of pocket costs for private insurance. There may be annual or lifetime caps on certain services. To add the specialized therapies that I was talking about, those can also be restricted on the duration or the frequency under private insurance plans. So when it comes time to choosing public or private healthcare, families who have children with disabilities or significant medical conditions, they'll usually benefit significantly more from public plans because they offer those additional services and have significant cost savings associated with them. It's important to keep in mind that private insurance may be preferred by some people because there could be broader provider networks because they can serve as a supplement to when people are traveling and they just want to have access to more providers and have that flexibility. Um, I also want to add that a lot of parents who have insurance through their employer will use that as a primary insurer and then have the public insurance serve as a supplement when they need additional coverage for their families. Next slide. Cost is going to be another major factor to consider. So, for medical assistance, there are no premiums to pay. However, with Minnesota Care, it is a sliding scale based on income, with typical premiums ranging from as little as like a few bucks a month to less than $100 a month, which is pretty affordable compared to private health insurance premiums. For public insurance, there are no deductibles for medical assistance, but for Minnesota Care, there are deductibles. However, those are going to be minimal again, and they're typically less than private plans. There are nominal copays for services under public insurance, and they're usually about like $1 to a few bucks for prescriptions when you go and pick them up, and $3 for non-emergency room visits. So again, very minimal fees. When it comes to fees and spend downs, which are basically the same as deductibles, they're going to apply to people whose income exceeds medical assistance limits, but who have high medical expenses. So basically, monthly spend downs work like a deductible, which require payment towards medical costs before the coverage would begin for those services. For private health insurance, monthly premiums tend to be higher. However, they're going to vary based on the plan and the coverage tier. I was talking about like a bronze, silver, gold earlier. Usually, with private insurance, they do offer various options depending on your household size and the type of coverage that you need. Um, the average individual premium in Minnesota, I know of this year, is between $450 to about $600 a month, which is a lot for many families. In terms of the deductibles, they can be significant, often ranging from about $2,000 on the low end to about $8,000 annually, which is a lot of money before insurance starts to kick in. I know there are certainly like larger employers who have lower deductibles, and these are like your bigger corporations who have thousands upon thousands of employees who can afford to offer lower premiums and lower deductibles, and thus just have the bandwidth to have their insurance be more affordable. But for the majority of people that are on their employer sponsored insurance, their deductibles tend to be between that $2,000 to $8,000 average. For copays, they are typically higher than public programs. An example could be paying a $25 to $50 copay for an office visit or getting your medication. So overall, when it comes to cost, public programs are ideal for low income families. They're ideal for individuals and children, especially children with disabilities who are utilizing that TEFRA option. I also want to say public programs have predictable and affordable costs that make it easy for families to also budget for because you know what will be covered, which is almost everything that you would need to utilize in terms of services. On the other hand, keep in mind that private insurance is going to offer broader provider networks. So you have more options in terms of who you select to serve as your doctor or your clinic. So you're not limited on who you can see within the private insurance marketplace. That flexibility is nice, but again, keep in mind there may be higher out of pocket expenses when it comes to private insurance. Next slide, please. So speaking of flexibility, which is always nice, let's expand on that a bit and just talk about provider networks and access to specialists. So for our public options, including medical assistance and Minnesota Care, there's unfortunately a limited network of providers with not as many options for specialists. But that's again going to be dependent on the plan itself and what county you live in. So insurance may even require prior authorization for specialist referrals as well. If you are seeing a provider out of network for specialized care, they may also require additional approval. So there's just, keeping in mind there's going to be more jumps to or more hoops to jump through, which can be time consuming and become a barrier for people, especially if the care or the services they need is time sensitive. For private health insurance through your employer in the individual market, there's usually a lot more flexibility with which provider and specialist you can see. You can also usually access out of network specialists, although that's going to be at a higher cost because the cost breakdown are usually cheaper for in network providers. Some private plans will even offer nationwide or global networks, which is something new I learned when I came to Pacer. These are typically PPOs, which are preferred provider organizations. So, with this insurance, access to specialists usually doesn't require a referral from your primary care provider, but some may. And it's important to keep in mind that some specialists do reserve the right to request prior authorizations if they want to before they even offer services, even if your insurance doesn't require them. Sometimes they'll do it because they just want to guarantee payment either from you or from the insurance. So they even may ask for you to put down a debit or a credit card just in case the insurance doesn't come through. For out of state care and emergency services, coverage is generally like limited to in state care under public insurance. However, for out of state coverage, there may be an option for emergencies. So, an example could be there's a medical emergency when you're traveling out of state and you need to get to a hospital. The coverage is then going to be contingent on the nature of the emergency. So, keeping that in mind is important. What we may consider an emergency might not be considered an emergency by the insurance company. So when it comes to emergency services, those are going to be covered nationwide typically, but the provider you see needs to be enrolled in their respective state Medicaid program for the continued care you'll get beyond the emergency visits. So if you're going to Colorado and you need to go to the hospital and you're on public insurance, having ensuring that that state's enrolled in the state Medicaid program, which they should be, it'll help to provide coverage at that time. But keep in mind, like with most emergency visits, you have to see a doctor afterwards to get follow up care. And so you may not have coverage for those follow up visits like you do with the emergency visit. Typically you do, but there's always those case by case basis. There's usually no out of pocket cost for emergency services. But again, if you need follow up care, that can be limited. So under private health insurance, there's a lot more flexibility to use out of these out of state providers. National networks make it easier for people on private insurance to seek care outside of Minnesota, but it's important again. There's going to be additional costs for out of network services. In addition, emergency services are covered nationwide and often worldwide for with no out-of-pocket costs for emergency care under private health plans. So that's a really nice perk. If coverage is needed for follow-up care, like I mentioned, after the emergency, it's going to be important to check network restrictions because those may be applicable. Next slide, please. All right, so now let's talk about special considerations to give when we're looking for insurance for our kids that have significant medical needs. Next slide. So, under public insurance plans, there's coverage for just a wide range of therapies, which I think I alluded to earlier. So, this includes physical therapy, occupational therapy, speech therapy. So, these therapies are pretty critical for many children who have significant developmental or medical needs. So, private insurance may just have limited coverage or even higher out of pocket costs for therapies. For medications, public plans provide coverage for just a wide variety of medications that children may need, especially on a regular basis, and especially for specialized treatments and prescriptions. For private insurance, they're usually going to have more restrictions on medications and cost sharing for high cost prescriptions as well. Medical equipment is often a need for children with complex medical conditions. So, when it comes to public insurance, especially medical assistance, they're going to cover medically necessary equipment. So, that includes wheelchairs, adaptive devices, and home modifications, which can be very costly. Private insurance may not cover this equipment or the modifications the child may need as comprehensively as the public insurance, or they could have just significantly higher deductibles. So, public insurance programs can usually offer additional supports like those, and even like waiver services. So, this includes developmental disabilities waiver, which is also known as the DD waiver, and brain injury waivers and other family based waivers too. So these programs are going to be able to provide specialized support like respite care, family support, in home services. And these are typically not covered by private insurance. These waivers, I've seen firsthand how life changing they can be for families. They basically provide critical services they need that allow children with these significant healthcare needs to live in a home, to live in their home rather than having to go and get like institutional care um, or stay in a hospital. So they can be very life saving for many families. In addition, public programs like medical assistance, they're going to offer community first services and supports, which is very similar to personal care assistance. So basically, families can have a caregiver who can come and assist with daily living activities, which can help the family support children with these intensive needs. The caregiver could be a family member, it could be somebody the family hires through an agency. So basically, these types of services they're not going to be commonly available through private insurance plans, and they can get quite costly if you're paying for them out of pocket. For public health plans, there are also early intervention services that are available to families who have children with developmental delays, especially. So, and access to these services can make a really big difference in long term outcomes because the children are able to access them very early on in life, which is critical for helping them gain the necessary skills they need to get better and have that managed care. Regarding coordinating benefits between public and private insurance, it's going to be important to keep in mind third party liability. So, when a child is covered by both public and private insurance, I was talking about like the employer sponsored plan on their parents' health insurance as their primary, and the secondary being the public insurance. Third party liability provisions are going to be important to consider because they're meant to ensure public insurance, like medical assistance, can act as that secondary insurance, which ultimately pays for any remaining costs the primary insurance is not able to cover, or even portions that they're not able to cover. So, this coordination is going to be important so families don't have to face excessive out of pocket costs for treatment and especially for equipment that's medically necessary. So, for billing and payment, public insurance usually pays after the private insurance pays out. It's still going to be important for families to understand how to navigate the billing process to make sure all of these services are going to be covered too. So, it's important to do your homework and make sure that you're aware of what's covered and what isn't before the treatment happens. We do recommend families work with their healthcare providers and build those relationships with those providers to make sure that the both of the insurances are going to be billed correctly if families are utilizing both public and private, because you want to make sure you can avoid potential denials or even overpayments. So essentially, with this, the ultimate goal is to maximize coverage as much as possible. So by coordinating between public and private insurance, families can maximize that coverage especially for therapies, medical equipment, and treatments that may be partially or fully excluded by private health insurance plans. And when I say these are costly, I mean therapies themselves, if a child is getting it, seeing a regular therapist, even multiple specialties, they can easily run into the many thousands, tens of thousands each year. And that's not including medical equipment and other treatments that are provided under the medical assistance TEFRA option. Next slide. So now let's go ahead and talk about how to navigate appeals and denials. Next slide. Okay, so to start, a claim denial happens when your insurance provider is basically refusing to pay for a specific service, or a procedure or a medication that a person needs. So, common reasons for denials can include missing information, incorrect documentation that was initially provided, the service or medication isn't covered or considered medically necessary. There could be coding errors. It could be denied if there wasn't a prior authorization submitted, etc. So there can be many various reasons. I also want to emphasize what insurance considers medically necessary sometimes differs from what doctors consider medically necessary. So that's why it's important to have our ducks in a row prior to receiving treatment and services, so folks are not saddled with a hefty bill afterwards. Um, when it comes to denials, they can happen for both public and private insurance plans. So nobody is immune to denials, unfortunately. It's really important to understand the various steps you're going to need to address claim denials in the future. So to start, when you receive the denial notice, you want to review it in full. You want to check the reason why your claim was denied. You can usually find that in the explanation of benefits or even a designated denial letter in the notice. Usually there's a deadline listed for appealing the decision, which is going to be important to note because sometimes the window to appeal is short, and the window to appeal differs from public versus private insurance. You also want to make sure you understand your insurance policy. So this includes confirming coverage details, including any exclusions and pre-authorization requirements. For public insurance, you'll also want to review the Minnesota Department of Human Services guidelines. And then after reviewing coverage, you're going to contact the insurance provider to ask for like specific clarification on why the denial occurred, so you can document that on your end too. And then when you do reach out, you want to make sure you ask for a detailed explanation to make sure there wasn't an error, because those do happen. Sometimes insurance companies don't get it right. And so you just don't want to have to deal with the fallout if it was their error. So it's always good to follow up and do your homework to make sure that you're holding insurance companies accountable, and they're providing the services they're supposed to provide. Oftentimes, the devil's in the details, is what we say. And so when it comes to health insurance and understanding coverages and benefits, they can get so cumbersome, but it's just extremely important to know what you have access to and what you don't. Next slide. So under public insurance, if you're going to appeal a denied claim, then understanding how to navigate the appeal process is going to be important. So knowing your rights will make this process much more manageable in the long run. It's extremely important that you know what rights you have when it comes to being able to appeal these decisions. So to prepare for the appeal, you're first going to request a fair hearing. You do this by filing the appeal within 30 days of the denial, or in some cases up to 90 days, I believe. You're going to go ahead and use the form that was included in your denial notice that was mailed to you. You'll then send that form to the appeals division of the Minnesota Department of Human Services. And again, this process is for denials under public health insurance. You can also call the Minnesota Department of Human Services division to make sure you have everything in order before you go ahead and submit your paperwork. That's not a bad thing to do, because you don't want to submit the paperwork and then find out later you missed a step, and now the process has unfortunately been delayed. So then after you submit the paperwork, you're going to begin gathering documentation. So this is the evidence you want to use to support your case on why the appeal should be granted. So this is going to include proof of income, proof of any assets you have in your name, medical records showing the need for the service you were denied, letters from your healthcare providers explaining why the service is necessary, and then any other evidence to support your case. You'd rather have more evidence than not enough, because you want to make sure that everything is being considered before a decision is reached. You may be able to request continued coverage as well. That's something to note. So if you're appealing the termination of your benefits, let's say it wasn't just a claim that was denied, your full benefits were terminated, you can request that coverage continues while the appeal is being resolved. So there isn't a gap in coverage. You'll want to make sure you make this request within 10 days of receiving the denial notice. So make sure that you're checking your mail regularly, because that window to request that continued care is very short. So then once the hearing is scheduled, you're going to go ahead and attend the hearing so you can make your case. The hearing is typically conducted by a human services judge from DHS. It may be in person, it may be by phone, or even virtual. You'll get a hearing notice that will explain the format. So make sure that you're reading that in full so you know how to best prepare and attend the hearing. At the hearing, your priority is basically to present your case as clear as possible, and make sure that you're submitting all supporting documentation. You do have the option to just represent yourself. You can also have somebody assist you if you want. That could be a lawyer, an advocate, a case manager, or even a friend or family member that you trust that you want there to support you. After the hearing ends, you're going to receive a written decision from the judge. So if your appeal is successful, best case scenario, your services or your benefits will be reinstated and approved. If the judge's decision is not what you had hoped for, unfortunately, you're able to request that DHS reconsiders, or you can also file an appeal in district court. So there's other avenues if the first step of the appeal process doesn't pan out the way you want it to. There are also legal support options. So we can provide a resource list following this workshop, um, because there are quite a few helpful like legal aid organizations that do specialize in working with people who have significant disabilities, especially ones that are medical in nature. To note, the process for appealing is very similar for those with private insurance. So, appeal deadlines may be different, and the appeal request would go directly to the insurer. So, for example, let's say you have employer-sponsored healthcare, and the insurer is Blue Cross Blue Shield. You would then appeal the denial directly with Blue Cross Blue Shield. If the insurance company then denies the appeal, you do have the option to request an external review through the Minnesota Department of Commerce. So, similar to the appeal process for public health insurance, if the initial appeal is rejected, there are other avenues to try and get a favorable outcome if you feel strongly that you shouldn't have been denied. Next slide. All right. So I talked a little bit about resources available to families. And just to reiterate, we're going to have an exhaustive list that goes out after the workshop with contact information that you can refer to. But just to give you a little overview, so there's key organizations that are really here and designated to support you and your family. Uh, there's us, the Pacer Center. We do a lot of information referrals, a lot of education and advocacy work for families who have children with disabilities or individuals with disabilities. Our job really here is to advocate for you and make sure that you have the information you need to be successful so you can serve as your child's best advocate. There's also the Minnesota Disability Law Center that works solely with families that are experiencing discrimination based on disabilities. There's county case management. So the nice thing about county case management is that it's free. You don't have to pay for it. This is a service that we utilize through our taxpayer money. And depending on which county you live in, you can do a quick Google search. So if you're in Ramsey County, you can Google Ramsey County Social Services Office, and they usually have a dedicated intake line where you can request an appointment to have an intake done on you on your child, and then from that intake they'll be able to determine what supports you need and thus what services can be offered to. Some tools to consider. So we talked about MNsure, where people can purchase health insurance on the marketplace. There are many resources on MNsure that are extremely helpful. At the bare minimum, just understanding how opting into the marketplace works and what sort of services you can expect coverage from, etc. I'll be sure to link that website when I send my follow up email. And then Disability Hub Minnesota. So this is a state sponsored resource. It exists very similarly to Pacer. Pacer, we're a nonprofit center, so we're not state sponsored. Disability Hub is state sponsored. So this is a state resource that's meant to direct you to any resources and supports specifically designed for the disability community. And then I briefly want to mention financial assistance programs. So for children that have been certified disabled through the state, oftentimes you see them eligible for supplemental security income, SSI. Um, Sometimes it's not a lot of money, but it can be some where it can provide some financial relief. And the same applies for adults. There's also family support grants. So we talked about waiver programs. There's also grant programs that families may be eligible for that can provide them like in-home support if they need in-home support, educational support for their children, etc. And typically, these grant opportunities are usually referred by county case management services. So. One of the first things we recommend when people call into the Pacer Center is, have you connected with the county case manager yet? If you haven't, then that's going to be a really critical step so you can see what all you're eligible for. Next slide. All right, so survey time. I want to learn just a little bit about where people are currently at. So I want to pose the question, what issue are you experiencing when trying to understand how private and public health insurance works? This is multiple choice, so you'll see a poll hop onto your screen any moment now, and you can select any of the options. I put in this poll for my understanding to see where people are currently at. And who knows, this might influence future workshop options that we can provide to families and professionals. If this poll doesn't apply to you, you can ignore it. But if it does apply to you, we'd love to hear feedback. So we'll go ahead and give folks a minute to respond. And I have one of my fellow colleagues on here to help me with technology and navigating some of the Zoom features. So, Jamie, whenever the poll closes, if you can display the results, that would be really appreciated.
We'll do. Still have some people showing up as answering, so I'll just give
Okay.
it maybe another minute. All right, I think I'll end the poll
Okay.
and I'll share the results. You see
Okay.
those?
Wow.
Okay.
Oh, sorry. Go ahead, Jamie.
Oh, do you see them, the
Yeah.
results?
Yes, I do.
Okay.
Thank you.
Yep.
All right, so it looks like the last option was the most popular, trouble finding resources or support to navigate the insurance system. So that's one of the reasons why we're here to support you through these workshop opportunities at Pacer, because there is an abundance of resources, but it can be very difficult to understand how the systems operate in the public sector and private sector and how they sometimes intertwine, especially when families have double insurance. Um, it looks like there's also quite a few people who said lack of clarity on how to coordinate benefits between private and public plans. And that's why I talked a little bit about third party liability. Yes. All right. And then even split between 1, 2, and 4. Okay. So when I send out that resources list I was talking about earlier, I'll make sure that it's going to be a comprehensive list that will also address some of the scenarios you see on your screen, because we want to make sure you can understand not just the resources that are available to you and your family is, but how to go about navigating the system and which providers can assist you, whether they're county-based providers or individual agency providers. All right, so with that being said, I know I've been talking for quite some time, and we have about 17 or so minutes left, so we're doing great with time. I'd like to open this up for just a Q&A to see what kind of questions people have, and if there is clarity around anything I've talked about so far, I can also provide that. So I'm going to actually go ahead and check the Q&A, and then I'll also check the chat. Uh, just in case there's questions in that too. Okay. Let's see. So there's a question. Do you have any resources on the process of obtaining medically necessary equipment? For example, due to elopement, a provider could determine that a safety bed is medically necessary. Uh, yes. There's one that comes to mind that I can share out. There are several agencies that or specifically provide like medical equipment for various disabilities, and so I can certainly share out that resource. Um, I should also mention that specialized equipment for, especially for children with disabilities, usually under the public option medical assistant, it's going to be covered, um, because you'll be working with your child's provider, their healthcare provider, to determine what supports would be best for them in the home and when they're trying to navigate independently. So I'll make sure that that resource is shared out. There's another question. When does a disabled person become eligible for Medicare and how is it accessed? Um, so to clarify, um, for I mentioned medical assistance under the TEFRA option. So that's specific. So TEFRA is specifically designed for people with disabilities, so they can access medical assistance. And so oftentimes we'll see parents still utilizing their employer-sponsored health plan as their primary, and then using the TEFRA option as a secondary, so their child's supports can be covered. And so I think that's what that question was geared towards. Applying for medical assistance. So there's a couple ways you can do it. You can apply at minsure.org. That's the marketplace website that I was talking about earlier. You can also indicate when you apply that you're applying for the TEFRA option, if that's what you're going for, or you can just apply for straight medical assistance. Or you can connect with a county case manager in your county, and they can work on the application with you. You can also apply in person at your local social services office. Anyone under 65 is eligible for medical assistance in Minnesota, and then folks 65 and older would then be put on Medicare, which is essentially medical assistance for our senior population. Next question. So my child with a disability is now an adult. Uh, is all the info you provide is still relevant except for TEFRA? They could, yes. So they would basically still be eligible for medical assistance, depending on if their disability has improved or if they still have that disability. They could still qualify for like the waiver programs and the types of services I talked about. So that wouldn't go away. They would still be eligible for the supports they need as it relates to their disability. Somebody asked, is MA medical assistance required to get county case management? So I'm going to flip that one around. So if you want to access medical assistance, you can reach out to your local social service agency and request county case management services, and then from there apply for medical assistance. However, if you just want to apply for medical assistance, you certainly can on minsure.org. Typically, county case managers will reach out to folks who have medical assistance, because you would have to reapply and re-enroll, especially as situations change. So, kind of by default, you would be connected with the case manager, but to the degree that you work with them will be dependent on you. Somebody asked, what can county case management do? For instance, can they set up appointments for you? So that's going to differ a little bit from county to county. Um, the setting up of appointments. So um, typically, this is where community first services and supports, aka PCA services, come into play. So the nice thing is, if you're a medical assistant and qualify to have a personal care assistant, they can certainly set up appointments for you. Um, County case management can do that to a degree, but it depends on the nature of that appointment. So it's kind of hard to answer across the board. It's going to be dependent on the services. Another question, can my child with an IEP, an individualized education plan, still be eligible for medical assistance after being denied? Um, I'm going to read that again. Is that in reference to being denied the IEP or medical assistance? Can my child with an IEP still be eligible for medical assistance after they're being denied? Um, So yes, they could still be eligible for medical assistance. I'm also going to switch that one around as well. So individualized education programs, in terms of eligibility, that's going to be dependent on the child's needs. And if any assessments they've taken has found that they need an IEP to be created for them. Medical assistance for the most part, it's dependent on the eligibility criteria that I was talking about earlier. So income, your age, household size, disability status, if that's relevant, etc. Because IEP it's a service that you access in your child's school that's typically separate from medical assistance. But I also want to add, if your child was denied an IEP and you feel like they shouldn't have been denied an IEP, that's something we can work with you on to figure out the next best steps. There's also another question. I cannot get medical assistance, so curious if I can still have county case management. I heard they bill for case management through medical assistance. Yeah, so for county case management, in addition to providing medical assistance, they also can assist with coordinating other services as well. So think of SNAP, so the federal nutrition program for families who don't make enough to pay for food for themselves or their families. In addition to medical assistance, there's also like transportation services that county case management can assist with getting you set up for. There's also employment assistance and like job training that county case management can support with. So it's not solely just for medical assistance support. So you can still, if you were denied medical assistance through the county, you can still reach out to your county social services office and request an intake to see if you would still qualify for case management services through them. Okay, I hope that was helpful. I'm also going to check the chat. Yes, I'll be sure to share the resources. And then someone asks, how do I start the DD waiver application? So that's the developmental disabilities waiver for my 20-year-old son. His case manager has not been answering my phone calls. So thank you for this question. Unfortunately, we've been getting similar questions to this very recently. And the biggest reason is many counties are very much backed up right now with case management intake requests. And unfortunately, they just don't have the staffing supply to meet that demand. And so from what I'm hearing, there's a longer wait for people to hear from case managers. One thing I will recommend, so if you're calling them or emailing and they're just not responding or taking way too long to respond, I recommend setting aside like a half day during the week and going down to the social services office and requesting to speak with them in person. Usually Tuesday through Thursday is not as busy. But the thing about going during the day is most folks have to work and have other obligations, so you would have to work around that. But I found success with going in person. I say this because I actually coordinate a lot of care through my little sister's case manager within Anoka County where they live. She has cerebral palsy, and so I help my family with coordinating that care. And her case manager takes forever to respond, so usually I have to go down to the office to get any response, which gets really frustrating. And it really depends on the time of the year too. Just during certain periods, her case manager just takes much longer to respond. Other times, she picks up the phone right away. So, unfortunately, this is also going to be a case by case basis. Um, I also want to say for the any waiver applications, those are going to be through the case manager at the county level. So you would need to get connected to the case manager. If you're exhausting all these options and you're just not getting luck with getting somebody to respond, you can request your case manager's supervisor's contact information, so you can go up to their supervisor, and sometimes that could be enough to get you a response. Um, I can make sure that in the resource list I'll send some more information about the various waiver programs. But I just want to emphasize sometimes it takes a few tries reaching out to case management at the county level to get a response. I hope these answers were helpful. Let's see. I'm not seeing any more questions. Again, like I mentioned, I'll make sure to send out that resource list. This workshop was very much meant to be an overview, so we're hoping to provide more workshops that are within the public and private health insurance space in the future, where we can hone in on some of the more various components that we talked about tonight. Next slide, Jamie. So we have 7 minutes left, and we're doing really great on time. Before you go, just a few things to note. You're going to get a notification to fill out an evaluation. This helps me to understand what went well tonight, where I need to improve this workshop, and how we can be better. So please fill that out. It would be extremely helpful for us. And then we're always hosting workshops. So we have an entire list on our website, www.pacer.org, where you can see what we have coming up and then register for those. And then my contact information is also on the screen. You can email me, call me. My work cell phone accepts text messages, so if it works better for you to text, you are welcome to text me as well. When I send the email follow up, I'll make sure that my contact information is also shared with you. Thank you for attending. We're ending a few minutes early, which is always a good thing. Hopefully, you can stay inside, stay warm tonight, be with your families, have a nice dinner. Thank you again for giving us your time, and hopefully, we can see you again at a future workshop.
All right, with that, Bahia, I will end tonight's webinar. Thank you.
Perfect. Thank you.